Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office. It's Friday. Once again, we're joined by St. Clair County Board Chairman Mark Kern, and of course, the lady that brings us the numbers, which have went up again, Sam Bierman. Sam, welcome again back.
Thank you. They have gone up as they have for, I don't remember how many days we've been doing this now, but they've gone up every day, and they have continued to do so today. So as we have done in the past, all of the numbers that I will be reporting to you for St. Clair County are St. Clair County residents that have been tested. And as of today, we are at 1,122 that have been tested. We are at 258 positive cases, which is an increase of 16 from yesterday, and that includes both males and females from the age of 20 up to the age of 90. We are at 769 negative test results, with 95 test results still pending. And I'm happy to report that we are staying at the same number as we reported yesterday for deaths, so very happy to announce that there are no new deaths in St. Clair County. For state totals, we are at 130,163 that have been tested and 27,575 positive test results, which is an increase of 1,842 for the state. For state deaths, we are at 1,134, and sadly that is an increase of 62 for the state. And as always, our thoughts and prayers go out to the families who have lost loved ones to this virus, as well as the healthcare providers that have cared for them. As far as hospitalization numbers, the newest set of numbers that we are bringing to you, right now for St. Clair County hospitals, we have 82 COVID-related patients that are currently admitted, and of those 82, 16 of those are on ventilators. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we've been doing this for many days now. We had thought that perhaps we were at the peak, but it appears that we're now at a new peak, which means that you need to continue to do what you're doing, stay home, wash your hands, do all those things, because we have not seen this virus subside to any extent yet. As a matter of fact, we think we're still on the rise level. So it remains imperative for everyone to do exactly what we've been asking you to do and continue with that. Today we have 4 guests on our live feed. All 4 have great messages and different messages to give. Before we get to them, we'll do our zip code report. 62201, we have 8. 62203, there are 9. 62204, there are 8. 62205, there are 7. In 62206, we have 22. That is an increase of 2. 62207, there are 14. That is an increase of 1. In 62208, there are 18. 62220, we now have 17. That is an increase of 4. 62221, there are 26. That is an increase of 2 COVID positives. 62223, there are 19. 62226, there are 36. That is an increase of 2. 62258, there are 11, and that is an increase of 1. And in 62269, there are 21 COVID positive patients. That is an increase of 1. And please remember, any zip code that wasn't addressed, that doesn't mean there isn't someone there with COVID that has been diagnosed COVID positive. What it means is that there are not more than 5 in that location, in that particular zip code, that have been diagnosed. So take precaution wherever you are. Continue to do all the things that we've asked you to do. We've got to get this level to where we're not spiking. We've got to get to leveling off and going down. We can only do that by social distancing. Earlier in the day, Governor Pritzker made an announcement about schools, and we are joined by Susan Sarfati. Susan is the St. Clair County Regional Superintendent of Schools. Thank you for being here today, Susan.
Well, thank you, Chairman.
So do you want to detail what did the governor actually say in his announcement?
Well, the governor finally has ended the speculation about whether schools will be back in session or whether we will continue with remote learning for the rest of the school year. And he did declare that school buildings will remain closed through the end of the school year, and that remote learning will continue for all children until the end of that school year.
And so a school year is defined by the particular school district. Some schools
Yes.
get out a little bit earlier than others. So how do people find out when the end of the school year is?
Well, at the beginning of the school year, most schools print a calendar for the entire year, what days are holidays, when special events are happening. But the calendar changes over the course of the year depending on snow days, of which we've had several. And then, of course, due to the COVID-19, the school calendar has changed greatly. So it will be, you will be receiving, or parents will be receiving information from their individual school districts about their school year end date.
And a school year normally lasts 180 days?
There's a total of 180 days, and that includes things like parent-teacher conferences and teacher improvement days and those kind of things. So that is the legal minimum number of days.
And this only then takes us to the end of the school year. It doesn't start to talk about summer programs or anything like that. This seals the deal with this school year.
We are only talking about the regular school year. No decisions have been made about summer school. I know that as soon as you find closure on one piece of the school calendar, more questions will crop up. Things like summer school, transitioning back into the start of school, will school start at the scheduled time? All those questions will be answered as we go forward and as we find our numbers peaking and then declining.
Great. Anything else that we need to address with the public?
Not at this time, but more information will be coming, I'm sure.
And your website is a valuable resource for anybody looking to keep their students interested, the young kids at home. You've got a lot of programs on your website. Give that one more time, Susan.
Sure. It's www.sccroe50.org.
Great. We appreciate you being here today and
You're welcome.
clarifying what the governor's order was.
You're welcome. Thank you for having me.
Thank you, Susan. So, as we've said throughout this pandemic, the only way we're going to solve this is if we listen to the medical experts. All the politicians in the world can put their heads together, and they're not going to be able to solve this without science. And science is what we're going to be talking about next with Dr. Jigar Hindia. He has been here before, and he is an ICU intensivist at Belleville Memorial Hospital. Welcome back, Doctor.
Thank you for having me. I appreciate it.
So how are you doing as the environment? I know last time you were here, a lot of stress involved. I know you had stresses that you have a large family and you got to look out for them too. Just tell us a little bit how you're doing.
So, throughout the week, we had a pretty steady number of patients. It was pretty stable throughout the week. And I had this thought that perhaps we'd reached our peak, at least in the area. But over the last day, we've had more cases come through, more PUIs come through. So at this point, I think we've not reached our peak. It is still an ongoing process. So, we're not out of the woods yet.
So I heard today a news report that talked about ventilators. Maybe can you go into a little bit, what percentage of COVID positive patients that you see actually go on a ventilator, and is a ventilator an effective tool for treating COVID, or are you learning more about that as this goes along?
It's a great question, actually. This is an evolving science. So if you look at overall patients that have COVID-19, about 80% of patients will have mild symptoms. They can be at home, not be hospitalized, and they'll be fine. About 14% of them will have more severe symptoms that require being in the hospital, and 5% will require critical care stays in the ICU. They'll have more severe disease. Out of that, I would say, when we first began this process, we were doing early intubations. The data from China and the case reports from China all said to intubate early, to put people on a ventilator early, because that was felt to be the right course of action. And so we did. And nationwide, we all did. What we're seeing more and more is that perhaps we can use other modalities to try and keep people off the ventilator. There are other modalities like high flow nasal cannulas, CPAPs, things that we initially avoided, but now we are seeing more utility in perhaps preventing people from being on a ventilator. A ventilator does not cure the disease. What a vent does is if somebody has severe pulmonary compromise where they can't get enough oxygen or their muscles fatigue from the laboring to breathe, the ventilator will give them supportive care where we can provide the breaths for them, the oxygen for them, while trying other ways to heal the person, whether it's supportive care with treating symptoms, or whether it's antivirals or other modalities. The ventilator is not curative, it's supportive. But now, really as a nation, we're sort of rethinking the whole early intubation ventilator strategy. And so this is still an ongoing process. It is not definitive yet. What is definitive is that when patients are severe enough, when they can't tolerate a high flow cannula or a CPAP, a ventilator becomes their only option at that point in time.
Is it fair to say that, so you just talked about advice came from China. Is it fair to say then this is an evolving science? And so how are you communicating? Are you communicating, or is there communication going on with doctors in New York that have just been through their spike to you, and then you're going to learn things and you're going to communicate that to the next area of the country that's impacted? Is that the way this works with medications as well as treatments?
Honestly, in this time of social media, that really has been a huge blessing for us to be able to talk to people all over the country and the world and get some more insight. Because this novel coronavirus is novel, it's new. We don't have a lot of research on what the best way to treat it is. And we're learning case by case, region by region, what others are doing to treat them and to treat them effectively. And so, things like Facebook, we're having Facebook groups where, thousands of physicians are on there and they discuss these things. And we kind of gather new information from these reports, and they're anecdotal, but they're helpful. There are more and more smaller studies coming up that are observational, that show what various hospitals or regions have done. So yes, we are learning on the fly, but we are gathering more data day by day on this.
So every time that we come on, we broadcast the new positives, the people that test negative, the people that are in ICU, but the public wonders why we never talk about who's recovered. And you could be, a person could be callous and say, well, anyone that doesn't pass away recovers, but that really isn't necessarily the right statistic. Can you talk about recovery, and does everyone recover the same? Is there a textbook example of a person who's COVID-19 positive?
Not really. The rough course of the disease is that typically, and this is a rough time frame, but the first 1 to 7 days is typically the initial phase where people have illness due to direct viral injury. Right? The virus directly or indirectly injures the alveoli, the air sacs in the lungs. And then after 7 days or so, when they might have a decrease in their viral load, they have a second, we call it biphasic response, a second illness, which is due to inflammatory cytokines. We call this the CRS, or cytokine release syndrome. And what that is in this second period after the first 7 days, they can develop, and I'm talking about the critically ill patients, that's who we see in the ICU, they can develop a cytokine surge, which cytokines are chemicals that are pro-inflammatory. Things like interleukin-1, interleukin-6, TNF-alpha, these chemicals are things that put the body's responses into overdrive. And this hyperinflammatory state can lead to worsening lung injury, it can lead to multiple organ failure, shock, and so that's the second wave of this. And that may last, again, roughly 7 days or so. Some patients much longer, some patients much less. Recovery itself is a hard topic to really pinpoint. And the reason why is because we don't routinely retest people a second time. That's due primarily to keeping tests reserved for those that need to be diagnosed. And so we don't routinely repeat testing on somebody who is tested positive. Now, we do occasionally retest people who are tested negative if we think it's a false negative. In some cases, some facilities or some providers want a second sample, even if it's a positive test, to see if it's still positive. But it is not done routinely. It's not widespread. And so we can't give an accurate number of how many patients that had gotten a positive test now are negative. And that would be the true documentation of recovery, of clearance, is a lack of the RNA in the PCR sample. But that is not being done routinely.
So as we roll into testing, we've heard that in the county there is now a blood test that is being commercially available. Can you talk a little about, it hasn't been approved by the FDA, what that means? Just kind of describe that test, and then from that go into whether or not there's the thought process that someone who's had COVID-19, that their plasma might be utilized for treatment.
Sure. Okay. So the first part of that, the new test, there's a finger stick test that tests for immunoglobulins or antibodies, and it looks at two different antibodies, the IgM and the IgG. And the IgM is the first response immunoglobulin. So when you have an active infection, an acute infection, the first immunoglobulin that you see in your bloodstream is the IgM. Then the IgG comes later and indicates more of a long-term or immunization to that particular pathogen. This test is pretty new. As you mentioned, it's not FDA approved, and we just don't know the accuracy yet. We don't know the false positive rate, the false negative rate. We don't have that information. To my knowledge, I've not seen that data. And so it's sort of a catch-22 because we want more tests. We want more tests to know who may have this virus, but we also want tests that are accurate. And just not knowing that data, I would take a step back and want to see that information before I'd recommend that to somebody.
And so what's the value of testing? I understand if symptoms are such that they're in ICU, you want to know if they have COVID-19 so you know that you're treating the right illness. What's the value of somebody who has a slight cough or a fever, knowing whether they have COVID-19 or not?
So sort of twofold. The first is that knowing that you have it, you hopefully will take the precautions to avoid spreading it to somebody else. And then the second part of that is that eventually the goal is to reopen portions of the country and the community. But to do so, ideally two things would happen first. Okay, the two things are that we'd have more widespread testing available, and we'd have a better job of contact tracing. And what that means is being able to identify people that are positive. So if we have widespread testing and we knew who was positive, those individuals could be quarantined at home. And with contact tracing, we could identify the places they've been, people they've been around, and those individuals could also self-quarantine. So to reopen the country, those individuals who don't have the disease or who are not at risk for the disease, it would be safer to be out in public and whatnot, knowing that those who do have the disease or risk for it are self-isolating and self-quarantining.
So do you see the environment in ICU improving at all during this, or are we still just hitting it hard and working overtime and everything that it has been in the past?
I think we're doing a better job of recognizing other modalities, like I mentioned a couple earlier, high flow nasal cannula, CPAP, things that we can use to try and prevent intubations, to try and prevent people from having maybe a more critically ill disease. The medication regimens that are being tried are still largely investigational. You mentioned convalescent plasma. I didn't go over that yet. So one investigational therapy that we're looking at is convalescent plasma. And plasma is when you take whole blood and you take out the red blood cells, the white blood cells, and platelets. And the stuff behind that, that's left behind, is all plasma. So taking plasma from people who have cleared the virus, and the definition that we're using is 28 days of no symptoms after a positive COVID test. Those people can be tested to see if they can donate plasma, and that can be used possibly as a treatment modality for those who have COVID-19. Now, this is investigational. It is still being researched, but that is an area that is being looked at right now. So that was just to answer your earlier question.
So we're just so appreciative of what you and the entire medical community is doing at this time. Tough times, and it's tough times when we really come to rely on heroes like you that are out there and have got this figured out, or at least you got it as figured out as it can be. Herb, you...
One question, Doctor. Appreciate you coming in. As the chairman said, it's always great to have somebody to come in with your expertise to relay to the followers on our Facebook page or what's going on. In your opinion, your professional opinion, would it be smart at this time for the citizens of our county to get lackadaisical and just think this thing is gone and start going back to normal?
So I mean, I'm not a politician, all right? I'm not an economist, but from the healthcare perspective, I don't think we've peaked yet. And so, the biggest fear is that people go out in public without this being under control and causing a second wave of infection. And so, at this point, we're not there yet, in my opinion. We're not there to where that can be done. I'd be curious to see what the plan is going to be as far as just how piecemeal we're going to reopen these places in our community. But as far as a returning to normal, acting like it's gone away, we're not there.
Very good. Thank you. Appreciate you coming in.
Thank you.
Thank you.
Dr. Jigger Hindia, thank you very much for coming in.
Thank you.
We hope you come back.
Appreciate it. Will do.
So, we were talking about testing, and we have an announcement about a new testing site. In cooperation with the state of Illinois, state and local elected officials, and Touche Regional Hospital, Southern Illinois Healthcare Foundation is pleased to announce the availability of drive-through COVID-19 test collection at its health center located at 100 North 8th Street in East St. Louis. The collection process will begin with a telephone call to 618-646-2596 in order to be screened by Southern Illinois Healthcare clinicians. The screening will involve questions about symptoms, possible exposure, age, work environment, and underlying health conditions, and if determined to meet testing requirements as prescribed by IDPH and CDC, the caller would be given a time window to arrive at the collection site that day. If the caller doesn't meet collection requirements, they will be provided information about self-isolation and staying home until symptoms worsen. So beginning on Monday, April 20th, the screening phone lines will be available Monday through Friday from 8:30 a.m. to 4 p.m. and testing site hours will be Monday through Friday from 12 p.m. to 4 p.m. All patients are eligible for screening regardless of their ability to pay. There will be no charge to patients for testing. If the patient has insurance, that information will be gathered during the phone call. However, there will be no cost to the patient. Results should be available in approximately 24 hours. The drive-through collection site will be accessed from the 9th Street entrance into the parking lot. Signage staff and Illinois State Police will assist with directing patients to the appropriate location. Once again, the phone number that you're going to call starting on Monday from 8:30 a.m. to 4 p.m. is 618-646-2596 to access this new testing site at Southern Illinois Healthcare Foundation's healthcare site, 100 North 8th Street in East St. Louis. And this testing will be available until further notice. So, the reason that they're able to set up that testing site is because of dollars that have rolled in from the state of Illinois and representing the 116th district in the state of Illinois today is Representative Nathan Reitz. Nathan, thank you for being here today.
Thank you for the invite, Chairman. It's always good to be around you guys, and Herb as well. It's good to see you.
Wow, that's good to hear that we want to be around Herb. So tell us about the role of the legislature during this pandemic. So are you in session?
So as of right now, session has been canceled until the foreseeable future. Basically, we were told to be ready to go back whenever that may be. But right now, we're not sure if we'll go back in May, if we'll go back in June. But we definitely have to go back and pass a budget, which if you've heard any of the governor's addresses, the budget is going to be a little of a shortfall.
And I think all of us are going to see revenues in decline.
Yeah, whether it be the state, a county, a city, I mean, everybody's revenues are going down, and it's definitely a different time right now than we've ever seen. I definitely haven't seen it.
So just because you're not in session, I know your phone works because
It does.
we've been in constant contact with you about helping us get personal protective equipment delivered. Are there other things that you've worked on with the governor's office to roll out?
Yeah, I mean, like most everybody, and I don't know if Leader Hoffman's been on here yet or any others, but most everybody's working from home, and like my office right now, you call, you leave a message. My assistant is working from home as well, so we're checking the answer machine and emails and getting back to people. And it's still, even though we have a lot of people that are struggling to either get through to employment services or, whatever program you're trying to get through to, please reach out to us because we can still help. Our legislative people that we talk to all the time are still working, whether be it from home. I talked to somebody from agriculture on the way up here today, and he's reaching back out to a constituent probably right now as well to give him the information he needs. The process became a little longer. It's taken a little longer time to get information, but all the departments are still working.
So Nathan, Representative, can you give your phone number that the people that are in your district, they need to call your office?
Yeah, if they'll call 618-282-7284, please leave a message and we will return your call. The more detailed, the better. Or you can email us at repnreitz@gmail.com, and I usually see those right away. So one of us will get back to you as soon as we can.
So last week, or maybe it was earlier this week, all the days kind of rolled together. You rolled out a program with the state that's called Call for Calm. Can you talk about that a little bit and what that actually does? It's a valuable program for sure.
Yeah, Health and Human Services put together a program called Call for Calm, which we have a medical professional here today. So not only for our medical professionals or frontline workers, essential service people, and really now that we've talked about the school year ending, parents as well. I mean, stress levels are higher, anxiety is a little higher, so mental health awareness is critical during this time. So this is just another avenue to be able to talk to someone. It's a free service that's out there to help people who are having any anxiety, mental health type issues. The number to call or to text is text TALK to 552-020, and somebody will get back with you and talk to you and try to get you through whatever issue you're having.
It's tough enough to have COVID-19, but the mental stress and strain on top of all that can become untenable for a lot of people.
Oh, absolutely. We have people that are working a lot of extra hours. We have people that aren't working, whether it be financial stress, whether it be mental stress, there's somebody to talk to, and this is just another service that the state's starting to promote to allow that to happen.
And is that 24 hours a day, 7 days a week?
It's my understanding that it's 24 hours to text it and someone will get back with you and work on the program. One of the other ones that I wanted to discuss was the Department of Aging rolled out a program where I believe it was $7 million put into the program for meal assistance for seniors, which this is another time when we have a lot of seniors who have relied upon Meals on Wheels or just even trying to get to the grocery store, and that's became a little more challenging as well with what we have going on right now. Some towns have quit their Meals on Wheels, or some of the programs have cut back because of the COVID crisis. So there is a helpline that they can reach out to, and that's 1-800-252-8966, or they can visit the Department of Aging website to receive assistance for meals.
Mental health and food, those are two extremely important things. We appreciate you addressing those two issues and being so active in the legislature. We really enjoy working with you, for sure. Herb Simmons?
Yes, thank you, Representative, for all your assistance in getting the PPEs. Every time we've tried to get them, we've called you, as well as some of the other representatives. One question, are you getting any calls from your constituents concerned about when are we going to get back to normal, or fielding any of those type of calls?
We have been, and I'm hearing it about the same time that everyone else is. That's, this might be the new norm, the social distancing, I believe, and I spoke to the governor the other day a little bit about, people in public wearing masks. Is that going to be the new norm for the next year or so? It might be, but we haven't. I'm getting this information about the same time that everyone else is as of right now, so it's wait and see right now.
Okay. Well, we really appreciate you taking time today to come in and just share those concerns with us. Thank you.
All right, thank you for having me.
Thank you, Representative. Thanks for being here today.
Thank you.
So, we have gone from the medical community to state representative. The local level is where we sometimes the most impact, the closest contact to us is normally our mayor, the mayor of whether you live in a city or a village, whatever form of government you have. And today we've got a mayor here, the Honorable Chad Easton, the mayor of the village of Marissa. Chad, welcome.
Thank you, Chairman.
Our honorable welcome.
It's a pleasure to be here. I appreciate you inviting me to come on here, and Director Simmons, I appreciate you guys.
So tell how are mayors dealing with COVID-19? How has this changed your world? And delivery of services?
Well, it has, and just like all other communities, and as you go up the chain, it's impacted everybody. As for us, what we're seeing in our small community is kind of a surgence in the need to help and the want to help. We're really getting a lot of calls. How can I be of assistance? What are the programs that we have in place where I can help out? Whether it be our food pantry runs every Tuesday. They're making deliveries to doorsteps. There's food runners from all of our local businesses delivering food. But people have a genuine want to help in this. What we're seeing is, and everybody spoke on it, a new sense of normalcy. So in that aspect, it's good. The downside is, and I believe Representative Reed's touched on it, is the mental health issue in part of it. We are seeing an increase in domestic disputes and things of that nature. Being cooped up in a house all day with the kids out of school and families, being at home. So there's that aspect of it also.
So is City Hall open?
It is. Our lobby's closed. I gotta say, I got a great assistant in there right now, Donna Stewart. She handles, everybody will know her from the front counter, but she is answering all the phone calls. She's handling all my heavy work and making it possible for me to be on the phones and be on the conference calls and things like that. And she has really kept me in line and kept me in a right direction and what appointments and where I need to be at. So City Hall is open by phone. And as far as city services, obviously, our full-time police officers are working and doing diligently. And then our city workers, we've identified what is deemed essential for us, and those are daily tasks that are on a list. And we're rotating our guys in every day. So there's a set schedule with those guys, but I don't have a full staff every day. But there are just things that have to get done on a daily basis. So every day, they're doing that. So we're not starting any new projects or anything like that, but we are just trying to maintain until we get direction otherwise.
So I guess one of the new projects is with the governor's executive order telling people to shelter in place, your police are now having to enforce this order, enforce compliance. I know some communities are using drones to instruct people to go home and to disperse. Have you had any problems?
No, we have not had to use any means as far as tear gas or anything, crowd dispersion techniques. No, we've been really fortunate in a small community as Marissa. Word of mouth travels fast. I think they realize, my residents, I feel like, realize that, hey, there's a chance that it doesn't affect me as a young person, a healthy person, but I've got to do it because I have loved ones that I care about that are at a higher risk. And if I am out and about and I bring something, I catch something and it's not detectable, and I go check on my loved ones to make sure, am I doing the right thing? I see that a lot. So it's a lot of you got to kind of just self-police and do the right thing because it is for the betterment of the community. So
the fiscal aspect of COVID-19, your coffers have to be impacted. You're still paying salaries,
Sure.
and yet the tax revenues are drying up. Is the grant, I assume, hasn't been canceled, but that's a question mark. That's a big revenue source.
Yeah, that's a big revenue source, and as of right now, it has not been canceled. Also, our coal festival, the second weekend of August, that has not yet been any decision been made on that. But those are both very big economic impacts for our community. And like you said, everybody's financial impact is really yet to be determined. I mean, we have yet to see, how much business tax and things like that are actually not being generated. So it's just kind of a hold on to what you got and see what happens going forward. So.
And you're used to running with a pretty lean budget, so
yes,
you'll make it work.
We are, and we've done. I don't know, Chairman. Actually, it's a couple of things. We had a discussion. I know you have a lot of discussions, but we had a meeting a year and a half ago, and we discussed it, and we implemented some of the things that we talked about there. And I will say that the Village of Marissa is on a firm financial footing as of right now. So we are prepared to weather the storm. We have looked at different scenarios, and I'm proud to say that everybody has stepped up to do the right thing. So
Great. Well, that's a credit to you and your leadership.
Thank you.
Because that's difficult to
Yes.
do. Herb Simmons?
Welcome, Mayor.
Thank you.
Appreciate you taking the time, and I want to just thank you early on when this started some 30 days ago. When there was a report in your community, I called you, and within 30 minutes you were back on the phone and said that's a taken care of issue, and we really appreciate you getting on that. The weekly calls the chairman started, I think, has been very beneficial. You've been on all of them.
Most definitely.
So I think that's been a good communication line. And are you getting a sense of feedback from your residents about the information that's being relayed back and forth? I mean, are they
Sure.
staying informed pretty well?
Sure. So the first thing I want to touch on is that I forgot to mention, Chairman. I am very grateful for what you have done for all the mayors in all these communities as far as keeping us informed. I mean, I believe it's Tuesdays at 10:30 is whenever we have our mayor's meeting, and then if there's something urgent that gets put out, we get an email right away from Brian. It says, "Hey, be on this call at 2:30. Something's come up, and Chairman Kern would like to address the mayors and chiefs or whatever that may be." The dissemination of information that comes out from the county level, I can't stress enough how much that helps a small community like ours, because we feel like we have resources available to us, and that really is great. Now, as far as dealing with having people ask questions and deal with that, it is nice to have that knowledge. This forum, this Facebook forum, where people can get on here and listen for 30 minutes or 35 minutes, and I guess we're probably at 40 minutes at this point. But, having this, bringing a doctor on to kind of say, hey, this is what we're up against, this is the medical research that we're doing, and then bringing on, hey, this is how the state, Representative Reitz is stated, these services are in place, and then, with the chairman and with you, Director, that, hey, this stuff is what we're doing. If you got questions, seek out, mayors or board members or whoever it may be. And that's being utilized, especially in my community. I get Facebook messages, I get text messages, we get calls to the office. Hey, what have they said about this? And we know that you guys spend all this time putting this stuff out. But it's almost like a library of information whenever you guys disseminate all that stuff by email to us, that we can kind of catalog it and go through, and somebody's not trying to thumb through 30 days of Facebook posts, where we can catalog all that and we get that information out to them. And it's really been a blessing for us.
I know when we first brought that up on the first call, when we asked the mayors to try to put a PSA together, a public service announcement, you were the first one to jump right out there and did it. And I think you're going to be doing something like that on every Friday?
Sure. So our plan is, we always talking about the new norm, but we've, from the first time that it went out, the chairman would like us, to implement something to bring our community into that. We did the first one. It was a huge success. I was really taken aback by, we kind of have just now started to implement a quarterly newsletter. We don't have a local newspaper per se, the County Journal or the Belleville News Democrat, obviously, are the two big ones. But as far as just what's happening in our community, we kind of put out a quarterly thing. But the response that we get on just a weekly, the weekly Friday PSAs, really a big hit. So we're going to continue that, and then as we move forward through this, our plan is to just kind of give a weekly address on what the state of the village is. What projects do we have working on? What are our street employees doing? What's the library doing? Things like that. So you got to take a bright spot out of some of these more trying and difficult times, and I think that's one of them that we can, is the communication aspect of it.
Well, very good. Well, we appreciate you taking time today to come in, and we'll have you back next time.
And the big question is it Nathan Reitz or Nathan Wright?
I don't think you can go wrong.
You can't go wrong with Nathan.
It's such a household name.
Okay.
It just flows.
So I'll just stick with Wrights and you stick with Reitz.
That's correct.
Potato.
Exactly.
Okay. Thank you. Mayor.
So we're going to, just real briefly here, under the EMA part of it, before I get into that, I just want to give a shout out. Yesterday during our briefing, there was a major fire that took place in the East St. Louis Sojay area. Multiple fire units on the scene, multiple counties, even St. Louis City came over. I finally got to get down there after we slowed down here, and to see our first responders working, and I was really impressed to see that as they were rotating the firefighters in and out, they were still practicing social distancing. So that tells me that they are conscious enough to know they're out there fighting this major warehouse fire, but when they came back, took their mask and that off, they were still staying away from one another, because they have to go back to reality after their adrenaline is coming back down. So hats off to the 911 centers for managing all those departments that had to be called and keeping track of all of that. And then to go back into the pandemic mode, congratulations to all of you there. The hospital conference call this morning at 8 o'clock. Some more PPE equipment came in today, some hand sanitizer. 46 agencies were scheduled to pick up some items today, so we're moving forward with that with the help of our state representatives, as we heard today. In closing, you heard today the numbers went up again today in the positive cases. 16 new cases Sam reported on. You heard schools are staying closed. The numbers are going up, and they're going to continue to go up. You heard the doctor say he was hoping to come in here today and say we reached that plateau, and then in 24 hours we get a spike. So it's going to continue until it stops. That's just simple. And the only way we stop it is if you help us by staying home and staying alive. We'll be back here tomorrow afternoon. Yes, it's Saturday, but we'll be here. We're going to be here until this thing is over with. And then we'll be back in just a few moments with Cindy and Daisy to translate this into our Spanish communities. Thank you very much.